to him. Get up now.
So we're gonna start the lower body soft tissue work series with basically the psoas muscle, which it's basically the connection between our upper body and our lower body. So it could be categorized as either coming from here and it's attaching on lumbar vertebrae. It's a very sensitive area if we try to get in the belly of the tendon, and some people really try to dig in there, but if you really don't know your anatomy, obviously we have intestines that lay over it, so something I prefer to use is something soft for like that lower abdomen area, the psoas area. So we're gonna use the yoga ball and use a relaxed breathing strategy. So I'm gonna just basically lay down and put that yoga ball either side to side. So basically where the belly of the psoas is gonna be is between my big prominent hip bone and my belly button. So I'm gonna try to kind of pin that area. Inhale, push my stomach into the ball. Exhale, just sink down into it. I can also just kind of hit the lower abdomen just in the middle. Same thing, a lot of times getting at the lower abdomen muscles can help relieve some back discomfort. So the other tools you can use is a roga or a lacrosse ball, softball, tennis ball. The roga, what you would do is basically have it in a diagonal fashion, trying to get at that area I mentioned right here, or you can use a lacrosse ball the same way. Rather than taking something and digging it and rolling it side to side, I'd rather you just pin that area and just relax breathing, letting your weight sink onto it rather than being more aggressive. So I'm gonna pick between my big hip bone, prominent hip bone on the outside, and the belly button, pick between there, and you'll kind of know when you got it. It's pretty uncomfortable the first time you get at the psoas. So I inhale, push into that. Exhale, just sink down. So I would prefer you start with something softer to get a feel for this, especially if you've never had any manual therapy on the psoas, you never felt it. It's going to be pretty uncomfortable the first time. Now we're going to move on to the glutes next. So I'm going to show you how we can do this on a roller. I'll show you here on the roga. You can use a regular roller just as fine. If it is the roga, basically I'm going to sit into one of the outside grooves here. And I'm just going to roll side to side. So I'm going to come forward and back. I can play with some different areas and try to do a little bit more posterior, a little bit more lateral. And to intensify this, I'm just going to stretch the tissue a little bit and cross my leg over here. So if you cross over here, this is going to intensify. And we can also use the lacrosse ball to get a little bit more specific. So I can just roll a little bit side to side, just as we did there. But I really like the lacrosse ball for a pin and stretch move for the glutes. So basically what I'm going to do is pin down into it, and then I'm going to rotate my hip in and out from there. So I'm going to find different areas on the back side of the hip and just play with some rotation of the hip here. It's going to help loosen up those hips. Next, we're going to get into the TFL and the lateral hip. So basically, I'm just trying to affect tissues on the lateral side of the hip here. You can use a roller. If it's a roga, fit into an outside groove, and then you're just going to be in a sideline position, a little bit of up and down, or I could pin the tissue down here and then rotate in the opposite direction. So I'm pinning the tissue and then stretching away from it. You can also use a lacrosse ball in the same fashion. I'm just going to find right outside. I don't want to be right on a bone. I want to get the musculature and just roll a little bit forward and back, play with a little bit of side to side. Again, do what speaks to you the most. If something feels like it's ineffective, you probably don't need to do it. Next, we're going to get at the quads. So, something you can use a regular roller for or a roga. I just prefer this one so that our femurs can sit into these outside grooves rather than just smashing into them. So, I would start with a both leg approach. Basically, you're going to sit up in a plank position. The big thing you want to make sure of is that I'm not in an aggressive arch position here. I just don't want to put my back in a bad spot just to do some soft tissue work. So give yourself a little bit of ab engagement and kind of pull your belt line up to your belly button a little bit. And we're going to roll from above the knee up into the thigh. So start off with this. If this feels like it's getting easy over time, then you can bias one leg at a time. You have a little bit more pressure onto the roller and a little bit more freedom to play with some rotation, so I can get a little bit more lateral. I can hit a little bit more on the inside aspect. And it's going to be a little bit more intense that way. So another thing you can do for the quads is using a stick. Either kind of stick's going to be fine. you're just gonna kind of roll over the inside, over the middle, over the lateral side, speaking to kind of where you feel like you need it most. If you got a kind of a knotty area, you can give a little bit more attention in a quick fashion there, and then bring it back to a more global approach. The last thing that you can do is you can take a lacrosse ball just to target the tendon of the rectus femoris, which is our biggest, most superficial quad muscle, comes up to the hip. If I can get at the tendon there, a lot of times this can get really tight. A lot of people that feel like they have tight hip flexors, it could be the tendon of that rectus femoris, which can help relax the whole quad. So how I would do that is just kind of finding that tendon, pinning down, and just rolling a little bit side to side, a little bit up and down. When that's going to be a little bit more uncomfortable, so if you're going to try to target that tendon, which is going to basically be find the lateral hip bone, dip just below it. That's where we can affect that. Probably best to start off with a tennis ball before you move to something harder like a lacrosse ball or a softball. When we get into the hamstrings, you can use a stick. Is a good way to get at them. I can just sit and roll back here. It can feel a little gritty on the backside. Sometimes the stick can be a little uncomfortable, and you can use a foam roller as well. But the only thing about the foam roller is sometimes it can be tough to get enough pressure on here. A lot of times people don't feel much rolling here. I can do this with one leg or two legs, but I want to make sure that my shoulders are in a good spot. This is a lot of weight bearing on my shoulders, so this can feel uncomfortable for some people, reaching back here and manipulating their bodies around, and it can just sometimes feel ineffective. So a way that I prefer to target the hamstrings is using a medicine ball on a box, a bench, or something like that, and just basically kind of sitting onto it and then rolling forward and back a little bit. So it's a lot more of an effective way. You have more weight over your legs here, so it feels like you can put more pressure down onto it. And another technique in the same fashion is taking a lacrosse ball, tennis ball, and using a pin and stretch technique. So I'm going to find a tender spot, and I'm going to extend and flex my knee from there, just pinning down, and then taking my leg through movement. So when we get into the adductors, these are going to be like our groin muscles, our inner thigh. You can use a stick. It's a good way to target it. If I can just get at different aspects there. I like the stick for it. But again, I like the medicine ball probably the most for this area. It can look a little funky in your setup, but basically what you're going to do is get the inner thigh onto here and roll side to side. So if you don't have access to these tools, you can use a standard roller on the floor. I'll show you with the Roga, but regular roller works fine. And basically I'm just going to kind of do some short passes from the inside of the knee to the middle of the thigh. And then I'm going to do some short passes from the middle of the thigh up into the groin. So I'm kind of breaking that area up into two halves and rolling from there. If you really want to get at them, take a lacrosse ball, tennis ball, get high up into the groin, and then kind of pin down there and roll to affect the tendons where those adductors are coming in. But that's one that can be somewhat uncomfortable if you're unfamiliar with feeling that type of work there. So I would say start with a more global approach with a roller, a stick, or a med ball, and then you can move towards something like this if you're still having some trouble there. When we get into the IT band, it's a heavily debated topic. So when we're talking about a regular roller, I think you can roll the IT band, but not directly on it. I would more so roll the hamstrings on the lateral side and roll the quads on the front side, the lateral quads, which can sometimes get glued to that IT band. Rather than just direct pressure right onto it, it's really not going to affect it much. The one I referenced earlier, the TFL lateral hip, that's where the IT band attaches to. So if I can loosen that up a little bit, I might feel less tension down that lateral side. But you can get the front side on the outside a little bit, back side on the outside a little bit. If you're using a Roga, you can just set up as if the IT band was sitting right into that middle groove. So I can just get onto my lateral hip here and put that pressure right on because I'm not directly slamming right into the IT band. I'm getting those lateral structures of the quad and lateral hamstring. So just stay a little bit on the front side or the back side of it if you're using a roller, and you can use a stick to target any of those areas as well. It's going to work just fine. So when we get into the calves, I think the stick is the best tool that you have for this. So basically what you're going to do is take the stick behind both hands can apply pressure going forward, and then you can roll up and down. So I can do a little bit of the lateral aspect. I can get medial, come right down the middle, do a little bit lower, closer to the ankle, and then I can, if I find like a tender spot, I can kind of give a little bit more attention to a localized approach, and then bring that back to a global approach. So this is definitely going to be my favorite way to target it. Other ways that you can is a roller, but like I said with the hamstring, and even more so in this case, not a lot of pressure I can put on when my leg is out here and all my body weight is way back here. So I can roll over here, but it's probably not going to feel super effective. And you can use a ball, pin, and stretch technique if you need as well, if you don't have a massage stick available. So I'm going to roll here, and this is one where I'm going to find a tender spot, pin that ball there, and then flex my toes up to me and away. So I'm going to take my ankle through dorsiflexion and plantar flexion, pinning the ball in the position that it's in. So if you don't have a stick, I would probably recommend the ball as opposed to the roller. When we're talking about the tibia anterior, basically what we're going to do is lateral shin. So I'm going to find my shin bone here, the tibia. I'm going to go just outside of here and affect this area here. I don't want to come inside. It's not a very muscular area. There's not much there to affect. So I'm going to just come lateral and get at the muscle belly there. Stick's going to be your best way to get at that. You can use a Roga roller. This one wouldn't work with a standard roller, only with the Roga. And basically I'm going to get into a quadruped position and then roll from here. If I play with different positions of my feet, I can play with a little bit of different position there where I'm affecting, but I think the stick is definitely going to be your best way to target those there. So we're going to end this off with the feet. So we have two different tools I'll recommend. You can use a tennis ball, a lacrosse ball, softball. That's going to be the easiest way that most people have at home already. So basically you're going to be barefoot with socks on, and you're just going to roll forward and back. I'm going to find probably on that inner side into your medial arch is where you're going to find a lot of tension probably. So you can roll through there, roll through the bottom side of the foot, and then we can use a pin and stretch technique where if I find some that's tender, I'm going to grab my toes down and then extend them up and away. And this can be very sensitive, but a lot of times what I say is imagine your hands were in gloves all day. You'd lose the ability to move them, they'd get stiff. So if you can take your feet out of shoes every now and then and get more comfortable barefoot and work on some stuff on the bottom of the foot. That's our connection to the ground. And a lot of times if you can clear up some issues with the feet, you'll find your hip issues, back issues could be resolved just from something as simple as that. So if you have one of these, it's a good tool that I bought recently that I really liked, that I saw at a recent Perform Better Summit, the Rock Mat. So this is just basically different size knobs on a small piece here. And all you're going to do is walk back and forth. You can play with different techniques. So I can walk forward and back. I can walk side to side. I can play with different single leg stances here in different positions. And this is just a good way to stimulate the bottom of your feet. If you just spent a minute or two just kind of walking in different ways side to side in the mat, it's a good way to target the bottom of the foot without being really specific here.